So the NMC asked for 2,300 hours and you've ended up doing 2,700 hours. It's as if you don't need your time for anything else. You don't need your time for anything else. Why do you want to kill yourself now? Keep watching. Hi everyone, welcome back to my channel. My name is Wemimo and I'm also known as Start Number 5. If you're new to my channel, welcome, and if you're a returning subscriber, thank you for always coming back. And let's give a hand of applause to the new 132 subscribers that have recently joined my family. Thank you for coming to my channel. I really appreciate it. Right, so like I was saying in the beginning earlier on, that I'm a nursing student. In case you don't know, I'm a third year nursing student, and in this video I'm going to be sharing with you the things you will be doing as a nursing student in the UK while you're in your placement. So as you all know, I'm a third year nursing student. I'm currently on my second placement for third year, and the things I'm going to be sharing is going to be based on my experience so far as a nursing student. So the things you'll be doing as a first year student will be different from what you'll be doing as a second year student and what you'll be doing as a third year nursing student. So for me, when I started my first year, we had some training within uni before we set out to go on placement. So these trainings might differ based on different universities. We had training in terms of taking vital signs, checking blood pressure, checking temperature. All of these are basic things that you should know. So in case you don't know, the uni will teach you and stuff like that. So as you all know, NMC, Nursing and Midwifery Council, they are the body that regulates the nurses and the student nurses as well. So when I said student nurses, it means that as a nursing student, anything you do, you're responsible for it. If you commit any medical error, if you commit anything mistake while you're treating a patient, you are going to be liable for it, not the nurses who have asked you to go do those things. And while you're on placement as well, if you are to carry out any activity or throughout your session of training or throughout your training till you finished, you will be heavily supervised by a registered nurse. So you have a mentor and an assessor. So now I think they are called supervisor and assessor. So both of these people, you might end up working with both of them at the same time, or you might end up working with either of them at different times. So anything you do while you're on training, you will be supervised. So as a first year student, when I first started, I've actually had care experience before. Like I worked in a care home before, so I knew the basic things like doing personal care and stuff like that. So if you have not had kind of that type of experience, so it will be ideal that once you go on your placement, you you make the LK assistants your friends, like, because you learn loads of things from them. They will teach you how to do the personal care in terms of bed making, in terms of when the patient, because the healthcare workers, they are there for when the patient is being discharged. They will strip the bed, they will wash the bed and make up the bed after the cleaners have come to clean the floor. So the healthcare assistant will hand out towels to patients in the ward. Like they do all the in-house things within the ward, while the nurses do all of the nursing interventions and everything for patients. So if you're someone who've not had any care experience before, or you've not had any personal care experience before, or working with patients, so the healthcare assistants are the people you want to try and work with for the first 2 weeks of you starting your placement. And secondly, before you go out on your placement, try and Google the ward you are going to be going to. So if you're going to cardiology ward, type in cardiology ward, what do they do in cardiology ward. If you're going to a respiratory ward, type in what do they do in respiratory ward. So you have an idea of what the ward you're going to, what they do. And again, I don't know, maybe this there's a website called Quimple. I'll leave it here. I don't know, maybe that's available to all, or maybe all universities in the United Kingdom are on this website. So with Quimple will give you like a page like that in regards to that what you're going to, that you can read up on what they do and the potential learning outcomes that you can achieve while on that placement. So I do that before going on my placement. Things that you'll be doing as a nursing student while you're on placement. One, as a nursing student, you are to be supernumerary. That means you should not be counted as a number. So on a ward where there's 10 patients and their staff levels are meant to be 4, and you there you are 5. So for the fact that you are 5 as a student, the staffing level should be recorded as 4 and not 5, because these 4 staffs are being paid, and you as a supernumerary, you are a student, you're not being paid, so you should not be counted as a number. Or if the staffing levels is meant to be 4, and because one person is off and they've now slot you in to start doing the activities of the person that was off, that is a no. If that is happening, you need to speak up, like either speak to your mentor or speak to the child nurse, or if you think they're not listening, then you need to let your uni or your personal tutor know about it, because you're not being paid. You're there to learn, and they should allow you the opportunity to learn rather than being used as part of the staffing numbers. And again, in terms of limitations, for me, I always know my limitation. I always stand by my limitations. I know what I'm good at and I know what I'm not good at. So what I'm not good at, if I'm being asked to do it, I step back and say, I'm sorry. Yes, I've been showed out to this, but I'm not confident about doing it. And the things that I know I'm confident about doing, I do it confidently. I go to meet my mentor. We have a chat about it, and I'm certain that I've done that. So that's for me. So always identify and stick by your limitations, because at the end of the day, like I said earlier on, if you commit any nursing errors, you're going to be held liable for it, not the nurse who is looking after you, or not the assessor who is meant to be your mentor. So in terms of the activities you're going to be doing as a nursing student while on placement, you're going to be carrying out personal care. So if you happen to be in a elderly ward, maybe an elderly ward where patients ages from the age of 65 and above, yes, you'll be carrying out personal care, taking care of their hygiene, ensure they are washed, change their pads and stuff like that. You will be doing it. So, and when you are doing this, it's not like you are cleaning your baby's bum. These are elderly patients that you need to be careful for, because they will have fragile skin, and you just need to be very careful when you're carrying out personal care. So you're going to carry out personal care. So in terms of, if you've not had care experience before, the healthcare assistants are the best staff for you to work with for the first 2 weeks of your placement, because you will learn a lot from them. You learn how you learn the duties of the ward with them, because they do all the in-house job for the ward. So you learn quite a lot from them, like where they stack the towels, where if you're looking for anything on the ward, just grab an healthcare assistant. They will show you everything. Stocking stuff as well, the healthcare assistants are the best bet for you. And when it comes to nursing tasks, so let's say a nurse wants to go administer a drug to a patient, you can observe, you can watch. As a first year, second year student, you can observe, watch how this nurse is doing it, but you can't give it. I believe after your second year placement, you should be able to start giving drugs under supervision. So you do the ward round and the nurse is right there with you, looking at what you're doing. Yes, you're being looked. So it's as if you watch the nurse do this thing several times, and then they're giving you a shot to do it as well. So remember, when you're giving your medications, you need to remember the 5 hours. I'm going to pop what the 5 hour, what it means. I'm going to pop it on the side here for you. Remember, make sure you are doing all of that before when you are doing your medication round. So when it comes to like giving injections, we barely, here in the UK, they barely do give injections except blood thinners. Blood thinners are the ones that go in the tummy. So I think I started doing that during my 3rd placement for 2nd year, and when I do it, I am supervised, like my nurse is standing there and I'm being supervised. When I give the insulin injections to people who are diabetic who needs insulin, my mentor is standing there while I'm doing it. Even as a 3rd year student, my mentor is standing there while I'm doing it. So when it comes to taking out venflons, I remove venflons. Obviously, as a 3rd year student, that's what I do. But as a 1st and 2nd year student, as a 1st year student, you won't be able to do that. You can only just observe. As a 2nd year student, you will surely be observed as well, because I didn't get to start taking venflons out until my 1st placement in 3rd year. Yes, I did not start taking venflons out till my 1st placement of 3rd year. Some have been doing it, but it's a no-no. So anything that I've not been trained. So let's say, for instance, when I was in 1st year, the things that I was trained while at uni, if I get to placement, I'm able to do it. So 2nd year, the things that I've been trained, that I've been taught about, that have been discussed about with my teachers while at uni, if I go on to placement, I'm able to do it. So while as a 3rd year student as well, I had a training about we were trained on how to do venipuncture. We were trained, so that, which means that once I started my 3rd year placement, I should be able to do venipuncture. I should be able to take bloods. But if you're not confident about doing it, you don't have to do it. For me, I'm not confident about doing it because that training was just a training on a dummy. You know, chucking into a dummy is different from chucking a needle into a human arm. So I'm not confident in doing it yet, but hopefully maybe by the time I go to my management placement, I'll be able to have more shot at it. Third year student, I write nursing notes. So when it comes to nursing notes, I only write nursing notes for patients that I've actually cared for. So patients that I've actually done personal care for, looked after them, maybe giving them towels and stuff like that. Those are the kind of patients I'll actually do nursing note for, because there's no point in doing a nursing note for a patient you've not actually looked after. So what do you want to write in their note? I don't want to start falsifying documents. So I will only write nursing note for a patient or patients that I have looked after. So I attend MDT meetings, so that's the doctors, the physios, the OCPTs, the nurses, where you sit down to discuss patients and their well-being and stuff like that. So I attend that, and I also write the notes for the ward rounds. I also take samples to the lab. I did my first 2 catheters, so I catheterized 2 patients, 2 female patients. So I'm able to do that because we're trained that in second year, so I've been able to do that during my third year placement. And there are lots of things to be done on while you're on placement, but like I said, if you've not had a certain training about something while you are at uni, please, when you go out to placement, don't do it. So if you are a first year student and you've not been trained on how to do venipuncture, and you get to your placement and they're asking you to do venipuncture, please do not do it. If you're a second year student, you've not been trained on catheterization, you've not been trained on injections or giving blood thinners in the tummy, and you get to a placement and they're asking you to do it, please do not do it. Don't do it. I'm telling you this because like I said, if anything goes wrong, you are being held liable for it. So you don't want to start having cases recorded against you before you qualify. So like I said, everything you are doing, you are going to be heavily supervised up until you graduate. So for me, I'm going to be finishing in August of this year. So anything I am doing up until August, I'm going to be heavily supervised. Like anything I do is under intervention. And there are some things that I do that my mentors don't have to like supervise me, because they've seen me do it, they've seen my strength in that thing, so they gave me the opportunity to do it. So let's say, for example, when I do a nursing note, so I write it and then I just take it to the nurses to read it, and then they countersign it. So because they know, yes, whatever I've written there is what I've done, so they do it, they just countersign it. So before I finish, in case you are feeling overwhelmed, like, oh, there's a lot of stuff, you don't know what to do, I don't know if I should do this first, I don't know if I should do that first. Yes, it happens like that, and the one word you'll hear throughout your training is prioritize, prioritize, prioritize. So if you're a nurse and you have a patient who is using 7, and then there's a patient who is waiting in the lounge or something that needs to be admitted, which of them is more important to you? Which of them should you prioritize? The one waiting to be admitted, or the one who is very, very ill and is scoring 7? You know the answer to that. And then again, lastly, you might be thinking, oh, how will I remember all of these things? How will I remember all these things? I don't know what this is called, this is that. That's fine. For me, when I was in year 1, I carry notebook, like a small jotter like this. I always have one of this in my pocket. When I was in year 2, I had one of this. So this is the one I'm currently using for my 3rd year. I have all my notes, everything, it's in here. So say for instance, there's a drug, clopidogrel, and you don't know what this drug is used for, you can easily just write that down, and then when you have the time, maybe you're at a computer, sit down and go look it through the BNF and look at what clopidogrel is. Or you are doing your word round, there's another drug called atorvastatin, and you're like, oh, I don't know what that drug is called. You can just write it down. When you have the time, go look over. And again, all these drugs, they vary. You might go to a cardiology ward and you see, oh, they use clopidogrel, they use atorvastatin, and then you go to respiratory ward, they use something different, and you're like, what's happening? Yes, so the drugs they have in certain wards is dependent based on the kind of care or services they give there. So like I said, if you go to a cardiology ward, the medication they use in a cardiology ward is definitely going to be different from the medication they use in the respiratory ward. So carrying a notebook is a very best bet, and you thank you. I mean, you can always even look back to this while you're a qualified nurse, because I remember one of my placement in cardiology ward, there's one of the students there who still had her notebook, and I've seen her several times referring to her notebook, which is good. So that comes to the end of my video. If this video has been helpful to you and you're happy that I did this, drop a comment in the comment section. If you're a student who is starting your first placement for first year and you're like, oh, I don't know what this is, I don't know how it's going to be, this video is very, very helpful to you. If you've got any other questions, drop them in the comment section. Or if I also a nursing student who's had multiple placement as well, share your comments in the comment section as well. And if there's any video suggestions in regards to nursing placement or being a student that you want me to talk about, leave them in the comment section for me. I'll be happy to answer them. And if you're yet to subscribe, what are you waiting for? Don't forget to like this video, drop me a comment in the comment section, subscribe, turn on that post notification, and don't forget to share this video, because it's going to be very, very helpful for new and upcoming nursing students out there. And I hope to see you in my next video. Bye.